I really deeply believe that we owe it to our kids, our community's kids, to our family and neighbors, to our coworkers, to the businesses throughout the city, to get vaccinated. It is safe, it is effective. It is the single most effective thing that you can do to ensure that we get beyond this and that we protect the life of those who can't be vaccinated and the kids in particular that can't yet. Thank you to everyone that took that step as soon as they could, and to all of you in the last week that have decided to jump in, head to the doctor's office and ask for your vaccination. As an employer, we're doing what I'll encourage all employers to do, and that is requiring masks in our buildings. And we're doing it to protect our employees and their families. We're doing it to protect the public who comes into our facilities. And importantly, we're taking care of the kids that are in our care at camps and other times. We see that as the role that we and other employers throughout the city and state, frankly, need to take right now.
If we accept certainly what has been said, that we're now in the fourth surge in terms of the United States, we at Primary Health started seeing an uptick of COVID positivity tests about 4 weeks ago. And to give you a sense of where we are right now, as of today, the number of positive tests that we're seeing daily are comparable to what we saw in January. The positivity rate of the tests we're doing now are 20%, which again is consistent with what we saw in January. You may recall that the recommendations by the CDC and all the experts is you want the positivity rate for the test to be 5% or lower. So we're 4 times that rate. The number of people actually being tested in our clinics, requesting tests, has tripled. Again, these numbers are comparable to January and December. The majority of those patients that are requesting a test are symptomatic. We also look at our data in terms of age ranges. Every age range has at least a double or triple increase. Most concerning is in the 5 to 12-year-olds. There's a triple increase in the positivity rate and also an increase in the number of positives. Also, there's an increase of the positive rate in the 12 to 18-year-olds and all the rest of the age groups. Again, all of those numbers are going in the wrong direction and comparable to what we saw in January and December.
We're kind of entering the class 5 rapids of this pandemic. And what I mean by that is for us to get through and achieve our objective, which hasn't changed, it's to preserve hospital capacity for care. Just like when you try to navigate a class 5 rapids, we all got to work together. Every single rower's got to put their oar in the water at the same time, and the right and the left sides of the boat got to work in tandem. Things are changing really rapidly. When Dr. Peterman and Dr. Nemerson and I met with the media just 2 weeks ago, at that time I shared we had about 40 patients admitted with COVID across our system. That was about 10% of our adult beds. Right now, as we speak, we have 78 patients admitted across the system with COVID. So we've doubled in 2 weeks. 19 of those folks are in critical care locations. More than 95% of these are unvaccinated, consistent with the data recently reported by the state of Idaho. And our average age is now down to 59 years. Now, I want to make a point on this number. 79 patients might not sound like a lot, but please recognize what that means. It means that 15 to 20% of our entire adult bed capacity is occupied by one diagnosis, and one that's growing rapidly. And we're also beginning right now to plan what and when we're going to be pulling back on elective care. Our people have continued to step up and take on more. So we're going to do our part. But we need to engage the public now to do its part. So if you haven't done so already, my appeal, like the mayor's, is to please get a vaccine today. This will make it so that you won't be one of our hospital statistics in the near future. It's also going to help us preserve capacity for care. It won't help us this week, but it might help us in 3 or 4. The other thing, though, that we can all do right now is follow, because we did it before and it worked before, is follow the guidelines that if you're indoors with people who aren't your family, mask up. That can actually help with this problem potentially as quickly as 7 to 10 days, given the shortened incubation period of this Delta variant. So
we're a pretty exhausted healthcare workforce. You know, as you mentioned, I appreciate your comments. We have frontline workers that have been pulling extra shifts and wearing full PPE for prolonged periods of time, sometimes working outdoors to test patients and do all kinds of things that have been challenging for about a year and a half. And just when it's kind of makes me think, I've never run a marathon, but it makes me think about, you know, coming to the finish line and then seeing another hill. And that's, I think, how a lot of our healthcare workers are feeling. So we really do need the community's help to keep themselves safe and also preserve our capacity. And we are fortunate now that we do have supply of vaccine. At the very beginning, I chaired the governor's task force. We had to figure out who got to go first. And that was a really horrible place to be, but we prioritized our 65 and over population, and I think did a good job with that. Now we're in the fortunate position of really having vaccine for anybody that wants one. And that's a wonderful thing, because we didn't have that at the beginning.
I'd ask the public, as they consider their vaccine decision, you know, to understand, of course, vaccines have side effects. None of the physicians on this call would say otherwise, but really try to move from the emotional space where a lot of us seem to have been trapped in this vaccine debate to a more cognitive one, and ask and answer the question, are you more likely to be healthy, not hospitalized, alive, with no long-term symptoms, with a vaccine in your arm, or with COVID in your body? And when you do that compare and contrast, no matter how you slice it or dice it, the answer consistently comes down, the vaccine is your best bet. It's frankly all of our best bet.
I think what we all need to understand is, unfortunately, Delta is a very different virus than what we dealt with in December. There's no question. It's incredibly more infectious. And there certainly seems to be data, particularly in England, that it's more virulent. And just to get an understanding, I think it's worth just taking a minute here about testing. When you do a PCR test, you're essentially measuring the amount of DNA of that virus. And we looked at 35 patients that had been vaccinated that were positive. And you can look at the amount of DNA that's there. It's what's called the viral load. And if you have a lot of it, it means you have a huge amount of virus. And if there's very little, then you don't have very much virus. Of those 35 patients we looked at, over 80% had a very, very large amount of virus, what I would describe as huge. And why is that significant? It tells us even with vaccination, you can not only get this virus, but you will carry a large amount, which means you are incredibly infectious. Now, there are two parts to that story. The first part is yes, the vaccine is not 100%, but no vaccine is 100%. And you're 5 to 8 times more likely to get infected if you're not vaccinated. But here's what we absolutely do know. If you're vaccinated, your chances of being admitted to the hospital are very, very small, maybe less than 3%. And your chances of dying even more remote.
The patients in the ICU with COVID are younger, they're sicker, and they're unvaccinated. And so we really want to do everything we can to keep that from happening. We have people in their 30s on ventilators, and we're not seeing that at the beginning, but we are seeing that now, which I suspect is partly due to the Delta variant.
This situation remains very dynamic, as it was just proved to all of us. You know, we let our guard down. We allowed ourselves the opportunity to get hopeful that we had maybe seen the end, and then here we are again. And like Dr. Burgess says, it's like the finish line just moved out 5 miles. It's a real bummer. But we'll get through this. We will get through this surge, especially if we all work together. And when we do, we're going to see those numbers come down. And stay tuned. These guidelines will change. That's something I've tried to make sure I cast when I'm talking about this. We just don't have the luxury of being able to say everything's set in stone and what we say today is going to be what we say literally 10 days from now. 10 days from now, we might be ringing an even louder alarm bell. Frankly, if the trends don't change, we will be.